Sciatica pain shooting down your leg is among the most debilitating and life-altering challenges seniors face after the age of 60. When a nerve in your lower back becomes pinched, irritated, or trapped, it sends waves of burning, tingling, and numbness down your leg, making it impossible to sit comfortably, walk without limping, or sleep through the night. Now hear me out. Research published in the Journal of Orthopedic Physical Therapy shows that adults over 60 with sciatic nerve irritation who performed targeted nerve gliding exercises experienced up to 70% reduction in leg pain within just 3 weeks, even when medications and rest had failed, because they addressed the mechanical cause, a nerve that was stuck, compressed, and unable to move freely. So there is hope. In this episode, Japan's oldest doctor will show you the single most effective exercise for sciatica relief that works for nearly 90% of people, plus 3 bonus exercises tailored to the specific cause of your pain. And if you stay with us through this episode, you'll understand exactly why your nerve is screaming, how to calm it down safely, and which exercise matches your unique situation, so you can finally get relief that lasts. Welcome back to the Senior Health Podcast, where East meets West to help you move freely, sleep peacefully, and live without pain. Today, we explore why sciatica becomes so common after 60, why the nerve gets trapped in the first place, and most importantly, the exact exercises that begin releasing it without making things worse. And to guide us through is Japan's oldest physician. Doctor, please tell us why this episode matters so much.
Thank you, John. This is one of the most important episodes we have done because sciatica is not just pain, it steals independence. I have seen patients who cannot tie their shoes, who fear getting out of bed, who have given up walking because every step sends fire down their leg. And yet, in most cases, relief is possible. The nerve wants to heal. We just have to stop irritating it and start moving it correctly.
That's exactly what I hear from my patients. The frustration of trying everything, pills, injections, even considering surgery, and still waking up in pain.
Yes. And what most people don't realize is that nerves are very sensitive. When irritated, small things set them off. But when treated gently and consistently, they respond remarkably well. The exercise I'm about to show you works for nearly 9 out of 10 people I treat, and it has for over 60 years.
So before we begin, I want to hear from everyone. Comment 1, if your sciatica pain is worst when sitting, or 2, if standing and walking make it worse. That distinction actually matters for which exercise will help you most.
Yes, please share. And do not worry, we'll address both situations today. And write down the timestamps of this video that are most important to you. In this way, you help others too.
Indeed. Now, before we get to the exercise, I want to start by understanding what exactly sciatica is. Why does this nerve cause so much more trouble after 60?
This is something I wish every person with leg pain understood. The sciatic nerve is actually the longest nerve in your body. It runs from your lower back, through your hip, down the back of your leg, all the way into your foot. When this nerve gets pinched, irritated, or stuck somewhere along its path, it creates that unmistakable shooting pain, burning, numbness, or tingling that travels down your leg.
So the pain in the leg is actually coming from the back?
Usually, yes. The nerve originates in the lower spine. When something compresses or irritates it there, or anywhere along its path, you feel it in the leg. This confuses many people. They think something is wrong with their leg when the problem is often higher up.
And why does this become so much more common after 60?
Several reasons. First, the discs between your vertebrae lose water content over time. They become thinner, less cushioned. This can cause them to bulge or herniate, pressing on the nerve.
Makes sense.
Yeah, it does. And also the spaces where nerves exit the spine can narrow. We call this stenosis. And the muscles around the hip, particularly the piriformis, can become chronically tight and compress the nerve directly, and all of these changes accelerate with age.
So there are actually different causes of sciatica, not just one.
Exactly. And this matters because different causes respond to different exercises. A bulged disc needs extension movements. Stenosis needs flexion. Piriformis, tightness, needs stretching. Doing the wrong exercise can actually make things worse.
That's why so many people try stretches from the internet and end up in more pain.
Precisely. But here's the good news. There is one exercise that helps almost everyone, regardless of the cause. It doesn't compress the nerve further. It doesn't force the spine into positions that aggravate the problem, but instead, it gently mobilizes the nerve itself and thus helping it glide freely out of the area where it's getting stuck. This is what I teach first to nearly every patient I see.
I'm ready to learn it. What is this exercise?
This exercise is called nerve gliding, or some call it nerve flossing. You can think of it like this. Your sciatic nerve is like a long rope running from your lower back to your foot. Somewhere along that rope, it's getting caught, pinched, or stuck. What we want to do is gently slide that rope back and forth, freeing it from the area of irritation so it can move normally again.
That makes sense. How do we do it?
Okay, lie down on your back. Take your affected leg, the one with the pain, and bend it up toward your chest. With both hands, grab right behind your knee. Not on the knee itself, but behind it. This is your starting position.
Okay, I'm picturing that. What's the movement?
From here, slowly straighten your knee. Extend your leg toward the ceiling, keeping your hands behind your knee for support. You're going to feel a stretch down the back of your leg. Now, this is important. Go only until you feel a good stretch, not until you feel pain. Nerves are extremely sensitive when irritated, and small things set them off. We want to calm the nerve, not aggravate it.
So we stop before it becomes painful.
Exactly. Find that point where you feel the stretch. Hold it for a moment, then bend the knee and return to the starting position. That's 1 repetition.
How many should someone do?
On day 1, I recommend only 5 repetitions. Nerves need gentle, gradual treatment. If 5 feels okay, do 6 the next day, then 7. Build up slowly to 10 repetitions. This patience is essential. Pushing too hard too fast will backfire.
And then there's a progression?
Yes. Once you can do 10 repetitions comfortably, we add ankle pumps to increase the nerve mobilization. At the top of the movement, when your leg is extended, pull your toes toward you, like pressing a gas pedal in reverse. Then point your toes toward the ceiling. That's 1 ankle pump. Do 3 to 5 ankle pumps while your leg is extended, then return to the starting position.
So we're adding more movement to the nerve at its most stretched position.
Exactly. The ankle movement creates additional gliding of the nerve, helping it release even more. Once 10 repetitions with ankle pumps feels comfortable, progress to 15 and eventually 20 repetitions.
I remember a study from 2019 in the Journal of Orthopedic and Sports Physical Therapy that found that patients who performed nerve gliding exercises daily showed significantly greater improvement in leg pain and function compared to those who only rested or took medication. The researchers concluded that mechanical mobilization of the nerve was essential for recovery.
That research shows what I've been saying for years. The nerve wants to move. When we help it glide freely, healing accelerates.
Now, I know you mentioned that different causes of sciatica need different approaches, right? So we are not finished yet. What about people who know their specific diagnosis?
Yes. We have 3 additional exercises, 1 for each of the most common causes. These are powerful additions to the nerve glides. Let me show you. The first bonus exercise is for those with a bulged or herniated disc. If you've had imaging that shows disc bulging, or if your pain is worse when you bend forward or sit for long periods, this is likely your situation.
What do they need to do?
Bulged discs respond best to extension or backward bending. Here's how we do it. Lie face down on your stomach, place your elbows directly under your shoulders, propping your upper body up slightly. In this position, you're already creating a gentle extension in your spine.
And then?
From here, push yourself up a little higher, straightening your arms slightly while keeping your hips on the ground. You're creating a gentle backward bend in your lower spine. We want to hold that for a moment, feeling the stretch through your lower back and then return down to your elbows. I recommend repeating this 10 times.
What's the progression?
When that becomes comfortable, progress to pushing up onto your hands, arms fully extended, creating a deeper back bend, still keeping hips on the ground. Work up to debilitating 20, even 30 repetitions over time. This movement helps push the disc material back toward the center, away from the nerve.
Okay, so that's for bulged discs. What about people with stenosis or degenerative disc disease?
For them, we do the exact opposite. Extension, because bending backward actually makes stenosis worse because it closes down the already narrowed spaces in the spine. Instead, we want to open those spaces up through flexion.
So the opposite direction.
Yes. Lie on your back again, now with your knees bent and feet flat on the floor. Notice the natural arch in your lower back. There's a small gap between your back and the floor. The exercise is to flatten that gap. Rock your pelvis backward, pressing your lower back firmly into the floor. You'll feel your abdominal muscles engage.
How long do we hold it?
Try to hold for 3 to 5 seconds, really feeling the lower back press flat, then release, and let the natural arch return. Repeat this 10 times. Work up to 3 sets of 10. This posterior pelvic tilt opens up the spaces in your spine where the nerves exit, giving them more room. It's
important that people understand these are opposite approaches.
Critical. If you have a bulged disc and do the flexion exercise, you may worsen the bulge. If you have stenosis and do extension, you close down spaces that are already too narrow. This is why knowing your diagnosis matters, or at minimum, noticing which movements make you feel better or worse.
What about people who aren't sure which category they fall into?
Then start with the nerve glides only. They're safe for everyone. But stay with me because there's one more common cause we haven't addressed yet.
Of course, we cannot skip this one. What is it for?
Yes. The third bonus exercise is for Piriformis syndrome. The piriformis is a small muscle deep in your buttock. The sciatic nerve runs directly underneath it, or in some people, straight through it. When this muscle becomes chronically tight, it can compress the nerve and create sciatica symptoms, even when the spine itself is healthy.
How do people know if this is their problem?
Piriformis-related sciatica often feels like deep buttock pain that radiates down the leg. It may be worse when sitting on hard surfaces, climbing stairs, or after long periods of walking. Some people can even feel a tender spot deep in the buttock if they press on it.
That's clear. So what's the exercise?
Lie on your back with both knees bent. Take your affected leg, let's say the left, and cross your left ankle over your right knee, creating a figure 4 shape. Now reach through the gap with both hands and grab behind your right knee. Pull that right knee toward your chest.
And we should feel the stretch in the left buttock.
Exactly. Deep in the left buttock, where the piriformis lives. You're stretching that tight muscle, releasing its grip on the nerve. Hold this position for 20 seconds, breathing slowly, then release and repeat 3 times.
This one feels good for a lot of people even without diagnosed piriformis syndrome.
It does. Many people with sciatica have some degree of piriformis tightness, whether it's the primary cause or a secondary effect. I often recommend this stretch for both sides, because when one hip is tight, the other often compensates and tightens as well.
Now let me ask, for someone watching who isn't sure which exercise is right for them, what's the safest approach?
Always start with the nerve glides. They help almost everyone and won't make any condition worse when done gently. Do those daily for 1 week. If you see improvement, continue. If symptoms persist, try adding one of the bonus exercises based on what your body tells you. Or better yet, see a professional who can examine you properly.
And when should someone stop and seek medical help?
Immediately if you experience sudden weakness in your leg, loss of bladder or bowel control, or numbness in your groin area. These are red flags that require urgent medical attention. Also see a professional if your symptoms are getting progressively worse, despite rest and gentle exercise, or if you've had symptoms for more than 6 weeks without improvement.
All right, everyone, let's make this actionable. Write this down for yourself. Start with nerve glides. Lie on your back, affected leg bent toward chest, hands behind knee. Slowly extend the leg until you feel a stretch, then return. 5 reps on day 1, building to 10. At 10 reps, add 3 to 5 ankle pumps at the top of each rep. Build to 15, then 20 reps daily.
And if you know your specific diagnosis, try the right bonus exercise. If you do not know what exercise is best for you, just ask us in the comments. And remember, nerves heal slowly. But they do heal. Consistency matters more than intensity. 5 gentle repetitions every day will outperform 30 aggressive repetitions once a week.
Start tonight. Do 5 nerve glides before bed. See how you feel in the morning.
Share this with someone who's been suffering. Sciatica can feel hopeless, but it doesn't have to be. And if you like this video, please hit the thumbs up button and subscribe.
And make sure to watch this next episode.
Oh, this is a good one. People should see
People should
this.
definitely watch. See you there.